Please start doing. Awesome. So with that, thank you everyone for being here. Let's get started. So good afternoon and welcome to Bishops in the Exam Room, the Trouble with Catholic Healthcare. Thank you all for joining us. My name is Marley Brakestone. I use she, her pronouns, and I'm the Domestic Program Associate at Catholics for Choice. In this role, I promote and strengthen pro-choice Catholic advocacy around the country, focusing on outreach, recruitment, and engagement of our activist network here at Catholics for Choice. Emphasizing CFC's voice as the leading expert on pro-choice Catholicism and reproductive health rights and justice, I build and sustain relationships with individuals and groups around the country, building community, helping connect activists to local partners and efforts, and distributing CFC resources to help folks prepare to speak up as pro-choice Catholics. So as you've probably seen in the news recently, the Supreme Court will soon hear a case that could slash Roe versus Wade and put abortion access at risk for all Americans, and everyone's kind of talking about it. This could make access near impossible for many people, especially those living in areas where Catholic health systems are really the only options they have. Catholics for Choice is a nonprofit that lifts up the voices of the majority of Catholics who believe in reproductive freedom. And we know that Catholics in the US and around the world are pro-choice because of their faith, not in spite of it, and raise our voices and do all that we can to make sure that everyone who seeks abortion in good conscience has access to it. This webinar is the first in a monthly series of Lunch and Learn webinars that will hold through the end of the year. So each month we'll convene to discuss everything pro-choice Catholicism and abortion advocacy, so that when it comes time for the Supreme Court to hear arguments in that case, we can organize and win. It's more important than ever that we come together as pro-choice Catholics to stand up, speak out, and tell our stories. By having courageous conversations like these, we can help impassion others to join us in this fight and create real change. We can't let the bishops, all of whom are celibate men, claim to speak for all of us and perpetuate myths about what we believe. And we can't let our opposition take away our right to follow our consciences when we're making our own family planning decisions. Before we get started, let's go over some general logistics and housekeeping rules for our time together today, as one does before these kinds of things. So since this is a Zoom webinar, you won't be able to show yourselves on camera or unmute your mics, but keep in mind that there will be a 20-minute Q&A at the end. So please submit questions via that function in Zoom. And in the meantime, if you have any questions or concerns, or if you want to ask a question, you can message the panelists and the hosts in the chat box. Speaking of which, my lovely colleague Tinsley will be running things on the back end and moderating the chat throughout the presentation. So please remember to be nice to Tinsley. If you're rude, we can kick you out of this meeting because we know that as Catholics, we care about our neighbors and we value truth and integrity and respect, and so nothing less will be tolerated in this space. Like I said, this webinar will be recorded and will be sent out to registrants later this week. But now let's get on to the cool stuff. So to kick off our webinar series, I'm pleased to present Bishops in the Exam Room, the Trouble with Catholic Healthcare. Today we'll be hearing from three awesome panelists. First, you'll hear from Glenn Northern, Domestic Program Director at Catholics for Choice, and also my boss and one of the best guys you'll ever meet, but I'm a little biased. Glenn leads and implements our US activities here at Catholics for Choice, including advocacy, outreach, policymaker education, legislative analysis, and collegial relationships. He directs our Catholic in Public Life Project, a nonpartisan public education initiative that helps Catholic policymakers in the US clearly articulate pro-choice positions grounded in pro-choice Catholicism and sound public policy. He also oversees strategic relationships with pro-choice Catholics, policymakers, reproductive health providers, religious and secular activists, and he believes in social justice, health and rights for all, and religious liberty. Before joining CFC, Glenn led constituency building and advocacy efforts at Planned Parenthood Federation of America and the Religious Coalition for Reproductive Choice. And he holds a degree in political science and women's studies from Williams College. Next, you'll hear from Lois Utley. Lois is the person you want to talk to and have in the room in any conversation pertaining to Catholic healthcare. She's the director of Women's Health Program and the co-founder of Raising Women's Voices for the Healthcare We Need. She's been active in the women's health and LGBTQ health advocacy and policy space for more than 30 years, working on local, state, and national levels. She's a frequent speaker at national and state conferences and has authored numerous reports and articles. She's based in Manhattan and serves on the steering committee of the statewide Healthcare for All New York Coalition and is co-chair for the LGBTQ task force. She'll also speak a little bit on her previous experience as the founder and director of Merger Watch, and was also vice president of Family Planning Advocates of New York State, director of public affairs for the New York State Department of Health, and an award-winning reporter and editor for the New York State government for the Albany Times Union. So basically, she's just one of the coolest people you'll ever meet, and we're very lucky to have her here today. And then finally, you'll hear from Gabriella Larios. Gabriella is an Equal Justice Works Fellow, sponsored by Anonymous at the New York Civil Liberties Union, where she engages in policy advocacy and litigation with a focus on challenging the use of religion to discriminate against individuals seeking reproductive health care and LGBTQ New Yorkers. During law school, she was deeply committed to social justice, civil liberties advocacy, and working with NYU's Reproductive Justice Clinic. She works on immigration equality and worked with the Legal Aid Society. She was also staff editor at the Review of Law and Social Change, and she graduated from the University of Florida in 2017 with a BA in Women's Studies, Political Science, and graduated from NYU Law School in 2020. And I just like bragging about the really awesome people we get to work with, so I'm very excited that all of you are here today. And we're grateful that you can join us in this important conversation. So now let's get started. Take it away, Glenn.
Thank you for this lovely introductions, Marley. Hi, everybody. I'm really excited to be a part of this webinar. First off, I want to clarify something. The Catholic Church does not own the Catholic hospitals. And while the bishops may not literally be in the exam room with patients, the impact of their policies leave many who want to receive healthcare compromised. And that's because these Catholic systems are bound by a set of guidelines that are not determined by best medical practice, but rather by an interpretation, we would say a misguided interpretation of Catholic teaching. Catholic hospitals systems are a growing entity, and I will let Lois go into a lot more detail about that. Lois has done a number of reports throughout the years, the most recent of which Community Catalyst did. We'll drop in the chat, but it's a fantastic report. But that really talks about the sort of growing prevalence of Catholic hospitals. And I also want to sort of take us back a tiny bit. I want to locate the trouble with Catholic hospitals and Catholic healthcare in the context of the bishop's larger crusade to recast religious freedom and religious liberty in the nation. I want to locate it in the larger context of denials of care, which have only increased during the last 10 years with backing from our increasingly conservative and majority Catholic Supreme Court. It's also good for us to remember that there are millions of dollars at stake in all of this when we're talking about Catholic healthcare. And that's part of the business interests which the bishops are trying to keep protected. Yet it runs in direct contradiction to many of our Catholic principles. The Catholic hierarchy is very interested in sort of keeping and expanding their part of the pie, but again, it's at the expense of the services which communities need, and at the expense of our Catholic principles, frankly. So let's dive into Catholic healthcare. So interestingly enough, Catholic hospitals began as relatively small and humble entities that served their communities in a time in US history when Catholics were discriminated against. And while they served everybody in the community, they actually served a lot of Catholics in those initial years, but they've grown into these immense conglomerates who, as we'll sort of dig into later, really ignore particularly the reproductive health care needs of the communities. I'm going to talk a little bit about the ethical and religious directives. So as I mentioned, they are a set of guidelines that Catholic hospitals and healthcare systems must follow. They were first published in the 40s, and the latest version was from 2018, and it was adopted by the U.S. Conference of Catholic Bishops. They've sort of revisited it and tightened different parts over the years and added pieces. Again, they're based on an interpretation of Catholic doctrine and not in best medical practices. And they prescribe hospital practice and prohibit a range of reproductive health services, including contraception, sterilization, in vitro fertilization and many infertility treatments, abortion, and frankly, they've led to trans discrimination and exclusionary policies and practices. And they are increasingly pervasive. I believe today 4 in 10 of the largest health systems in the country are Catholic. At Catholics for Choice, as Marley said, we lift up the voices of the majority of Catholics in the US and around the world who, as a matter of faith, disagree with our church hierarchy around issues of reproductive health rights, contraception, abortion, LGBTQ rights, and justice, and the role of religion in the public sphere. And while the hierarchy is clearly a part of the church, they alone are not the church. There are fewer than 400 bishops, and there's approximately 70 million Catholics in the US, and we are the church. And we support access to comprehensive reproductive health and trans-inclusive health services. Catholic healthcare systems purport to really uphold the mission of taking care of the poor, and that's what they were initially designed to do. But in the end, in very significant ways, they fall woefully short of the Catholic ideals and deprive the community of much needed healthcare services. So what do Catholics believe? 90% of Catholic voters disagreed with individuals being denied healthcare because of their sexual orientation or gender. Nearly 70%, 69, of Catholic voters disagreed with the idea that Catholic hospitals be allowed to use religious beliefs as a reason to deny patients access to certain medical procedures or medications. In short, Catholics want to make sure that folks can access the appropriate care they need. How Catholics anchor their affirmation of access to comprehensive healthcare services, they do in sort of 3 important principles of Catholic teaching. 1, conscience. 2, religious freedom. 3, social justice. So Catholics and conscience. Catholics are called to follow their conscience. We view it as both a beautiful gift and an obligation, and we deeply, deeply respect the right of others to follow theirs. It's something that's sacred to Catholics, but it belongs to an individual, not a building, not a hospital, or an institution. It's something that only an individual person possesses and something that only an individual can choose to follow. Catholic hospitals ignore the real consciences, the genuine, authentic consciences of individuals, of patients, of the doctors and clinicians in hospitals who want to provide, the best care for their folks, who want to provide contraception, who want to provide infertility services, who want to provide abortion, when they deny those doctors and those patients access to those services or the ability to deliver those services. That is a corruption of what Catholics actually see as genuine conscience. 2, religious freedom. Catholics recognize that we live in a pluralistic society. You know, there's many different religious beliefs, and they each can coexist and flourish when we have a pluralistic society and not a theocracy. None may be singled out for special treatment by the government. And it's critical that actors in the public sphere working for the common good serve the common good and play by the same rules. When Catholic hospitals refuse to provide important healthcare services needed by the community, despite receiving millions of dollars in taxpayer dollars, they fail to serve the common good. And the folks that get hurt most by this are the marginalized, are the folks who are already having trouble accessing healthcare, you know, folks who live in rural areas, Black, Indigenous people of color. Like, those are the folks that are hurt most by this, when in fact our third piece of our Catholic tradition, social justice, actually calls us to most take care of those who are struggling. So the third piece is really Catholic social justice. Within Catholic teaching, it's literally called the preferential option for the poor. But what it means is that we as Catholics hold very dear the notion of taking care of our neighbors, taking care of those who are around us, taking care of those who are vulnerable. And when Catholic hospitals leave patients who are seeking reproductive health care, patients who are seeking gender-affirming care, without those services, and sometimes in many places they are the only hospital that folks can go to, they really leave those folks high and dry, and they really are abandoning the principles of Catholic social justice, which they were first, which the hospitals were first initially created before they turned into these giant conglomerates. So that is sort of, I wanted to lay out a little bit about what Catholics think and believe around this. And then I'm going to pass it to Lois, who's going to talk a little bit more about the spread and prevalence of Catholic healthcare and the particular findings in their last report. Thank you, Lois.
Okay, thank you so much, Glenn, and thank you, Marley, and thank you, Catholics for Choice, for giving me a chance to talk. I should say, by way of introduction, I was brought up Catholic at Our Lady of Sorrows Parish in White Plains, New York, and if she were still alive, my mom would be very happy that I was hanging out with a bunch of Catholics. So I'm going to share my screen. Okay. Great. I'm hoping you all can see this. Can the other panelists let me know? Yes, okay, nodding, thank you. So, as Glenn has explained, Catholic hospitals that started out as small community hospitals serving primarily Catholics and, giving Catholic doctors who were, say, Irish or Italian, a place to practice when they were being discriminated against by other hospitals. They've evolved hugely since, I would say, about the 1950s, but particularly since maybe 1990 or so, or 2000. So I want to talk to you about how these health systems have grown bigger and bigger. We've done, as Glenn alluded to, a series of reports over the years, starting back in 2002, tracking the growth of Catholic health systems and hospitals to see, what's happening with them. And our latest report, which came out last fall in October, found that these systems are controlling more and more hospitals. Of great concern that they're expanding outside the hospital by taking over urgent care centers, physician practices, and ambulatory surgery centers. They're entering into partnerships with many non-Catholic health providers. And I did want to reinforce that point that Glenn made about, these are not church-owned, with occasional exception. There might be some that are owned by a diocese, but overwhelmingly, they are private nonprofit entities that are behaving much like other nonprofit and I would say for-profit systems as well. But the difference is they have to follow these ethical and religious directives issued by and enforced by the Catholic bishops. So just a quick refresher about what the restrictions are. As Glenn alluded to, no abortion, contraception, sterilization. Many people don't realize that infertility services are also not allowed because they're contrary to the Natural Reproductive Act. No safer sex counseling about how to avoid HIV and AIDS and STIs. Some Catholic hospitals restrict the provision of emergency contraception for rape victims. They may either not allow it or they may require a pregnancy test first, which is totally ridiculous because if you're already pregnant, you're not going to become pregnant from the rape. So it's a nonsensical policy, but it was a political compromise. They also may delay or deny emergency treatment for ectopic pregnancy or for essentially early miscarriages. End-of-life options can also be curtailed. It's been a big problem in the states where they have death with dignity. And LGBTQ inclusive care may be denied, and in particular, what is called gender-affirming surgeries for folks who are transgender. So how big are these systems? Take a minute to look closely at this chart. You will see that the #1 private hospital system in the entire country is this Common Spirit Health, which is a Catholic health system. You note that the name doesn't say Catholic this or that, it says Common Spirit. So that sounds kind of good, right? That's deliberate to make it less obvious that it's a Catholic hospital. Common Spirit Health owns 114 what we call short-term acute care hospitals. Those are basically your full-service community hospital. And 19,000 staffed acute care beds. That is a lot of beds. When you count in other types of hospitals like psych hospitals, rehab hospitals, children's hospitals, you're up to 385 facilities. They also own 100 physician groups, 137 ambulatory surgery centers, and 227 urgent care clinics. I just wanted to draw your attention down to the third biggest Catholic health system, which is Trinity, because you're going to hear Gabriella talk about that in a little bit, about a case going on in upstate New York. They are also huge. So it's no longer the little Catholic hospital down the street, and it's not the money you put in the collection basket on Sunday that's running these things. These are big businesses. Overall, the number of Catholic hospitals has been growing. We've been tracking this since 2001, and we've been able to identify a 28% growth in the number of hospitals that are either originally Catholic or now are being managed by Catholic systems. Some of them used to be for-profit, and also some of the formerly Catholic hospitals are now in for-profit systems. So you wouldn't think that they were Catholic anymore, but they're still following Catholic rules as a result of the terms of the purchase and sale of these hospitals. So when you contrast 28% growth in Catholic hospitals with minus 9% in all hospitals, it's kind of worrisome. These are growing compared to other types of hospitals. The only other portion of the health system that's growing slightly faster is the for-profit end. So our health system is coming to be dominated by Catholic hospitals and for-profit hospitals, each with their own problems. 1 out of every 6 acute care hospital beds is now Catholic owned or affiliated. And some states have a particularly high concentration of Catholic hospital beds. So in 5 states, the ones you see in red, more than 40% of all the acute care beds are in Catholic owned or affiliated hospitals. And you probably wouldn't think, like the state of Washington, it's not a very Catholic state, but they have very big Catholic health system presence. Now, when patients have a choice of hospitals, the problem isn't so acute. But some communities have only one hospital and it's Catholic. So we found in our latest research that there are 52 communities across the US that have what's called a sole provider acute care hospital that's Catholic affiliated. So there's no other hospital within 35 miles or 45 minutes travel time. And these hospitals had more than 1 million emergency visits last year. And just to give you an idea of where these sole community hospitals are, you can see here, a lot of them are in the middle of the country, in states like Wisconsin and South Dakota has a lot of them. Some of them are in Texas. The green ones were on our list as of 2016. The orange ones are new ones that have become sole community hospitals that are Catholic since 2016. So Catholic systems claim a mission of serving the poor, and as Glenn alluded to, social justice principles. But when you look at the data, you don't really find that they're following that mission, not at all. So let's look at the middle column, which is Medicaid utilization. Let's look at the percentage of hospital discharges that are Medicaid patients. Catholic hospitals, 7.2%. They're slightly better than other nonprofit church like Lutheran or Methodist. They're below most other nonprofit hospitals, way below the public hospitals, which really have the mission of serving the poor and are doing it. And even for-profit hospitals are doing better on serving Medicaid patients than our Catholic hospitals. Now let's look at charity care, which is otherwise known as indigent care, care to people who have no insurance. Again, we see Catholic hospitals at 2.7%, which is lower than any other type except for nonprofit other. So not nonprofit other, it's a nonprofit hospital that's not associated with any type of religion. So there is no data to show that Catholic hospitals are doing a better job of serving the poor than other types of hospitals. In fact, Catholic hospitals receive nearly $48 billion in tax money annually through Medicaid and Medicare reimbursements, through special government grants. A lot of them, this figure doesn't include it, but a lot of them got a heck of a lot of that COVID-19 relief money when they were not really deserving of it, because as you saw before, they're not serving that many low-income patients. And I just want to give you end with 3 examples of how does this play out. Here was a mother of 4 in Troy, New York, who wanted a postpartum tubal ligation immediately after a C-section delivery of her 5th child. Unfortunately, her physician had privileges at several different hospitals and ended up being in a Catholic one at the time she needed the C-section urgently. And so she was told, nope, sorry, you can't have it. You have to go home. Even though she'd been under anesthesia, right, to have the C-section, she was told, nope, you have to go home. So with 4 existing children and a brand new baby, she had to heal up from the C-section and then go back to have the tubal ligation. That is just ridiculous, as well as medically not wise. Here's Tamisha Means out in Muskegon, Michigan, who was 18 weeks into a wanted pregnancy. She suffered basically an early miscarriage. She went to the only hospital nearby, which had used to be non-Catholic, but had been taken over by Mercy Health Partners. The hospital kept sending her home because they could still detect a fetal heartbeat, even though this was clearly a doomed pregnancy. They never told her that the best thing to do would be to terminate the pregnancy and that she suffered a risk of infection unless she did this. Only on her third visit, when she began to essentially deliver the fetus, did the hospital begin attending to her needs, and she suffered an infection. And finally, a case that I worked on, and was, very disturbing to everyone involved. Another case of a wanted pregnancy, a woman pregnant with twins. She lost one of them at home in a miscarriage, went to the ER. Her doctor here, Dr. Robert Holder, said, I'm really sorry, but this is just, this pregnancy is not going to be successful. We really should terminate it. The hospital had recently joined a Catholic health system. And so the hospital administrator stepped in and said, oh no, that's an abortion. We can't do that. And so they had to send her 80 miles away to the nearest non-Catholic hospital that would end the pregnancy for her. And here's her doctor who said he felt like he was forced to abandon his patient. The news of this incident led the hospital board to withdraw from the affiliation with the Catholic system and go back to being a non-Catholic hospital. So I'm going to stop sharing and we'll go on to Gabriella to talk about what it's like when your community is faced with having its hospital taken over by a Catholic system.
Well, thank you, Lois. And thanks again to Catholics for Choice for having me. I too was raised Catholic down in Miami, Florida. I went to Catholic school 14 years of my life. So yeah, it's nice to be here. So I'm going to talk a little bit about the merger that is happening right now in Schenectady County in the Capital Region in New York State. And I am going to talk a little bit about the history of Catholic hospital mergers in the Capital Region and where we are now. And the really complicated process that this all is. Like, I want to emphasize that this is not a linear journey. We are very much in the thick of it. And things change day to day, year to year. And it's a tough spot for a community to be in because, oftentimes you feel like there is no good option. So to rewind a little bit, the Capital Region has gone through several mergers relating with secular and Catholic hospitals. And, back in 2011 in Troy, New York, there was a really innovative solution that was created. It was at the Burdett Birth Center, which was carved out to be a hospital within a hospital at Samaritan Hospital. And this was supposed to be a solution to one of these mergers. Burdett was going to retain its independent status and be able to provide certain kinds of reproductive care, like sterilization, birth control, treatment of certain pregnancy emergencies, but abortion was a no. So for several years, Burdett continued to operate as this independent facility. It was able to provide all these kinds of cares that would have been stripped away had it been fully integrated into the Catholic Church, into Samaritan, which was governed by the ethical and religious directives. But unfortunately, back in October of 2020, it was announced that Burdett was being folded back into Samaritan Hospital because it could no longer retain its independent status. It was not financially viable. Running a hospital solely with maternity and reproductive care is not a moneymaker in a lot of ways. So as of last year, it was folded back into Samaritan Hospital, and a lot of reproductive care has been lost in Troy, New York. For a while, Burdett was held out to be as an example of what is possible when you come up with these creative solutions. And it's a model that was looked at across the country as something that was possible. So that's the background of what has happened in this region. In October 2020, Ellis Medicine and St. Peter's Health Partners announced that they were pursuing a proposed merger, a new partnership. Ellis Medicine is located in Schenectady County. St. Peter's is up in Albany. And as Lois, I think, alluded to, St. Peter's is owned by Trinity Health, which is the number 3, hospital system in the country. So back in October, as soon as this was announced, a coalition was formed to address these concerns. People were really worried about what this would mean for their community care, what this would mean for the future, like what will this look like 10 years down the line? What will this look like right now? So I want to really emphasize that this is a community-led effort. I think oftentimes these announcements by hospitals that they're intending to merge or intending to do something, are not newsworthy. It's very easy to ignore them. It's not something that, a lot of people don't know what it means for a hospital to merge with a Catholic healthcare system. So this coalition was formed to, first, one of the goals was to think about what sort of enforceable mechanisms and agreements we could negotiate between the hospitals and, anything we could do to preserve care. Like, would we be able to model something after Burdett again, but with better financial management? That was a possibility. That still is a possibility. The other one of the goals was to educate the community about what it would mean, and really seek input as to what people wanted from their community hospitals and what is the loss that a community faces when a hospital merges, not just with a Catholic hospital, but with a larger health system. Do you lose that community aspect of your hospital? How does this impact your relationship with your doctors, and all those things? So that is how this coalition was formed in Schenectady, and it has been led by clergy, county legislators, organizations, concerned community members, and that's what we've been working on. We've been trying to figure out what solutions are possible to preserve the most kinds of care. As somebody from the state affiliate of the ACLU, one of our entry points was the use of religion to deny care. That was not the sole issue facing this community. The proposed merger between St. Peter's and Ellis also raised a lot of other issues. There are a bunch of services being eviscerated, like a pediatrics unit is not staffed right now. The emergency room is being privatized. A visiting nurses program was shut down. So the religious restrictions piece of this is just one of the larger things that this community is facing as these hospitals agree to merge. So early on in our process, we reached out to our allies in different parts of the country, different states, primarily California, because we were looking to them to see whether there were any sort of enforceable mechanisms that we could turn to and use in this community to preserve care. And certain hospitals that are under the Dignity Catholic Health System in California have this thing called a Statement of Common Values, where on a hospital by hospital basis, there are agreements by which they can continue providing some kinds of care, like postpartum tubal ligations, contraception, certain types of gender affirming surgery. But they all, even these statements of common values, force you to give something up that is incredibly important: abortions, also death with dignity in states where that is an option. But even something like a statement of common values is not enforceable in the long term. Sometimes it's only an agreement for 5 years for a certain amount of time. So one of our goals as a community was to see what is possible. And alongside doing this research and figuring all this out, the two hospitals, Ellis and St. Peter's, announced that they were going to put a pause on their negotiations to wait and see what was going to happen with COVID and their finances. We were really engaging the community, had a community forum where people really voiced their concerns. All these things were coming together. And we really thought that we would have a lot more time to continue getting input from the community, bring this to the hospitals, see what kinds of care they were willing to give up and preserve. But in the past couple of weeks, there have been several recent developments and a lot of dealings behind closed doors in a way. And now Trinity is sweeping in to negotiate a physicians agreement with the providers at Ellis Hospital. And so Ellis Hospital has a separate maternity ward called Bellevue. And this physician agreement that's in the works right now is not affecting the practitioners at Bellevue. But Trinity and Ellis are already moving towards this partnership where they don't have to go before the state government to get this approved. They are pretty much, agreeing that every type of care other than maternity care and reproductive care is going to be governed by the ERDs already. End of life care is, once these doctors come under Trinity's control, there's nothing they can do at that point anymore, but they are not taking into consideration what the community needs and priorities are. They are not, giving advocates and concerned community members an opportunity to go before the Department of Health and voice these very real concerns. So in the course of, working with the community and getting to know people's stories and experiences, we also realized that Ellis Hospital is not somewhere where there's a lot of inclusive care. Like, there is currently no gender affirming care happening at that hospital. Because it's been in a financially strapped position, it has been difficult to provide comprehensive care of all kinds to its patients. So given all this, we have begun shifting towards a strategy of, trying to think of ways to carve out Bellevue, the maternity ward, and turn it into its own independent entity, or find it a different financial partner that won't have these religious restrictions as part of it. Bellevue has been the women's hospital in the region for years and years and years, and it has a great community reputation, and it's somewhere that the community relies on for comprehensive reproductive care. And as Glenn and Lois both spoke about, the ERDs impact reproductive care most significantly. So Bellevue itself, as somewhere that provides care to women and pregnant people, would be most affected by the imposition of the ethical and religious directives. So that makes it all the more important to preserve. But the NYCIU is also an organization that cares about end-of-life issues, but by working to save Bellevue, are we giving up end-of-life care as a potential fight? It's a maternity ward. That's not somewhere where end-of-life decisions are made. So these are all the questions that you are asking yourself as you are going to do this. Like, where do you divert your resources to? Where will you have the most impact? And for some of us, it feels like the ERDs will have the most impact in a space where reproductive care is had. But it's really difficult. I mean, even the parts of this merger that aren't affected by religious restrictions are very sad and a huge loss for the community. Like, the fact that lots of parents don't know whether they can show up to their sole community hospital and have their children admitted in a pediatrics ward is incredibly distressing and sad. And I think that is what the community is really grappling right now, what this loss of care will mean. And the questions that you have to ask yourself when you are going to do this is, what are you willing to sacrifice? What will have the longest term impact? So I wanted to paint that nuanced picture because that is the reality of the situation right now. And there is so much more work that still needs to be done. I think Glenn also mentioned, or Marley, one of you mentioned that the Supreme Court just announced it's taking up Dobbs, which is the case that could fundamentally alter Roe and overturn Roe. So access issues are at the forefront of everybody's mind right now, all across the country. I think, luckily, being in New York, we are not a state that has trigger laws that, everything will change if Roe is overturned, but access is still a huge issue, and being able to go to places where you have options is a major consideration. So, there's often this straw man argument that when a hospital merges with a Catholic hospital and, you lose the potential for abortions there, they can just go to their local Planned Parenthood, they can just go to their local clinic, but that is not a real alternative in all cases because, Planned Parenthood is not a hospital, it is a clinic. Most abortions are not performed in a hospital setting, but they're often the most serious and the most complicated abortions that have to happen because the mother's life is in danger, or it is so late in pregnancy where severe fetal anomalies happen. And some people really value having all of their care in one singular place. If anything goes wrong, they know that they're part of a larger hospital system. So relying on local clinics to absorb the care that might be lost through a merger is not a real solution. Albany Med, which is a huge hospital in the area as well, is only 30 minutes away. But to me, as somebody who knows how to drive, who has access to a car, 30 minutes means nothing. But for most residents of Schenectady County, they'd have to take 3 buses to get from Bellevue to Albany Med. That is not a real option for them. You know, even people who live in Schenectady County right now already have trouble reaching Bellevue. They already see transportation as a barrier, even if it's in the same county. So imagine now that you would have to take 3 buses to go and get your maternity care and reproductive care. You know, it's been shown that that makes it less likely that you're gonna get the recommended prenatal care. If you can't get contraception in your local hospital, where else are you gonna go? Teen pregnancy was already a major issue facing Schenectady County a while ago. So I think that is where I'll stop for now. It's, you know, very much a process that is in flux, and we don't know what the answers are here. And I think part of figuring out what that is continuing to engage the community, trying to think of creative solutions for what is possible and what will be lasting, because we don't want to have another situation where, you know, care is lost after 5 or 10 years and we're back in this situation. And as Lois' presentation made clear, you know, hospital consolidation is only continuing to increase. So it's hard work, but hopefully we can continue coming up with ways to make sure that people have access to comprehensive, evidence-based reproductive care. So thank you.
Thank you so much, Gabby, Lois, and Glenn, for this amazing conversation. I learned a lot, and I'm sure everyone else did as well. And as we were talking about, this is a really timely issue, especially as Roe v. Wade is even more at risk. So thank you so much for teaching us so many cool things. We have time for a couple of questions. So to start off, the first question is for Gabby. How can someone tell if their local hospital is Catholic affiliated?
First, go on their website and try and poke around. Sometimes it may take several clicks to get there, but usually somewhere in their statement of their mission statement, it'll say, you know, affiliated with Trinity, governed by the ethical and religious directives. So that is one way. Another thing that we're trying to do in New York is pass hospital transparency legislation, so that the Department of Health is able to collect data on where there are policy-based exclusions. So policy-based exclusions are basically services that aren't provided at a certain hospital for some particular reason, not just because you don't have like an orthopedics unit or something like that, but because there is an actual legitimate reason put forth by the hospital as to why they don't provide those services. So that's something we're working towards right now. We are hoping that by having the state collect all this information, patients will be able to go to a state database and figure out what kinds of care that they'll be able to access. And we're also hoping that this will let us identify gaps in care, so that we can continue to advocate for increased access to LGBTQ care, reproductive health care all over the country. But it is difficult to identify which hospitals are Catholic and which are not. There have been articles in the New York Times talking about how many studies looking at how many clicks it takes for you to even be able to find out if it's affiliated. And yes, thank you, Allie, for sharing the information in there. So ask questions and yeah, try and go on their website and make it work.
They make it more difficult than they should.
Absolutely.
The next question we'll direct at Lois. Someone asked, do any of you see practitioners at Catholic hospitals going against these restrictions and offering restricted care anyway? And if so, what could the consequences be for the provider and the patients?
That's an excellent question. For physicians and nurses who are employed by the hospital, which is more and more, that's the case, it can be a very serious issue if they try to violate the ethical and religious directives. Basically, they could be fired. Physicians who have admitting privileges at hospitals are often asked to sign statements promising to follow the ERDs. Nonetheless, I would say there are many providers, doctors, nurses, and others at Catholic hospitals who care a great deal about getting the patients the care they need. And so try to find workarounds to allow them to provide the care they need. I mean, for one obvious example, contraceptive counseling wouldn't be allowed. However, if they code the patient's problem as endometriosis, they might be able to get away with prescribing contraception. It does mean that the patient's medical records are basically false. So we've also heard of like nurses running out in the parking lot and giving emergency contraception to rape victims. I mean, they try to get around it, but it's not ideal.
Not ideal, that's an understatement. Thank you, Lois. The next question goes to Glenn and comes from our awesome partners in New Mexico. So it reads, during the debate in the New Mexico 2021 legislative session on the repeal of their pro-Roe abortion ban, a very conservative Catholic senator challenged Senator Ortiz y Pino, who is a Catholic in public life and part of our network, debate on the conscience that it must be fully formed, with the unspoken assumption that no one with a fully formed conscience would consider abortion. So Glenn, what is the definition of a fully formed conscience?
Yeah, that gets bandied about in exactly that kind of way. When Catholics are forming their conscience, they are supposed to take into account the teachings. They are supposed to take into account their own experience and come to a conclusion that is, from, as Catholics see it, it is really, the whispering of God in your ear about sort of what's moral and what's right. And so the idea that someone else would question someone else's conscience is pretty ugly, actually. You don't get to tell somebody else that they don't have a properly formed conscience. It's really as simple as that, but that was sort of a bravado power play over Representative Ortiz, but really a properly formed conscience considers experience, considers teaching, and then the individual is obligated to come to the conclusion that they believe is right. In fact, in Catholic teaching, Thomas Aquinas actually said, "He who does not follow his own conscience always sins." So it is incredibly important within Catholic teaching that we do the best to follow our own conscience, and you don't get to tell somebody else whether their conscience is properly formed.
Thank you. And one more question for Lois. We'll keep it short because we're running short on time. But is Catholicism the only religion that runs hospitals?
Another really good question. No. There are Presbyterian hospitals, Methodist hospitals, Lutheran hospitals. There's quite a few Jewish hospitals as well, like Mount Sinai here in New York, were founded by Jews. Seventh-day Adventist hospitals, Baptist hospitals. But what sets the Catholic hospitals apart is really two things. One, those ethical and religious directives that all the hospitals are required to follow. And two, the Catholic Health Association of the United States, which brings together all these hospitals and systems into quite a powerful political entity that is pressuring the president and Congress and, state legislators and governors around the country. You don't see that with the other health systems.
Very true. Thank you so much for that response. And with that, our time together today has come to an end. So again, from the bottom of my heart, thank you to all of our panelists for taking the time to be here and having this courageous conversation about Catholic healthcare. We're really proud and grateful for your partnership and the passion that you bring to this values-driven work. And thank you to all of you for taking the time out of what I'm sure was a busy Wednesday to spend this time thinking, growing, and learning with us. These conversations can be tough, but they need to be had if we want to see real change on the issues we care about. So in the next day or two, you'll receive a follow-up email with a recording of today's event, as well as links to resources that were shared in the chat and a few ways to take action to speak up as a pro-choice Catholic. This email will also tell you how to join our Facebook group and become part of the robust community that we're building there online. So again, thank you all for being part of our Catholics for Choice family and for joining us today, and we'll see you soon.